Do you use a Nomad in your operatory? I kind of love using it. I feel like it saves a lot of time when it comes to radiographs. What do the buttons mean though? So the first one is the on and off, of course. This one is going to change the size of the patient, which changes the amount of time with your patient, so your kid or your adult. This one is going to change if you're going to do a sensor, regular film, or a phosphor plate. And again, every time we change these settings, it's going to change the amount of time. So the higher the time, the more radiation you're going to get out of here, a little stronger beam. And it depending on what you do and what area of the mouth, you're going to need a different amount coming out. So this one is going to change the setting. So right now we're on anterior PAs, posterior PAs, bite wings. And I really do think it makes a slight difference. So when you do take your x-rays, do change the setting. So now we're having more, and it's going to change the look of your image, especially if you use any AI software. They're really sensitive, so you having the best image is key. This is going to manually change your time. It's not going to change your KVP or your MA, but depending on your unit, you might have to add a little bit more. I rarely touch these buttons, however, because it's usually pretty calibrated to what your operatory has. And then always turn it off at the end of the day. Do you use this unit at home, or not at home, but in your operatory? That might feel like home sometimes.